Hi, I'd like to talk to you about pregnancy-related pelvic girdle pain. So this is a very common condition. About 20 to 25% of people who are pregnant will consult their doctor or a pelvic floor physiotherapist regarding this type of pain. So pelvic girdle pain is pain along anywhere of the girdle of the pelvis. So for some people, they feel it at their pubic bone. Some people feel it at their groin or where their hip flexors are. Some people feel it on their hips. Some people feel it at the joints between their sacrum and their hips. So that's the SI joint. Other people feel it in their low back or on the insides of their thighs or radiating down the back of their legs. So how do we treat pelvic girdle pain? So we treat pelvic girdle pain in a biopsychosocial way. So this means that we're looking at it as the whole person. So we're looking at the level of stress that someone has in their life. We're looking at what their home life is. We're looking at what their work situation is, what their activity levels are. But then we're also looking at what their body's like. And so looking at if they're holding extra tension, if they're a little bit weaker. And then also a key component in terms of people who are pregnant is what they're feeling about the birth. And so we oftentimes see pelvic girdle pain in subsequent births. And so people might be holding on to memories or trauma of their first birth. And so that's a definite component that needs to be addressed when treating pelvic girdle pain, because if there's increased stress or increased anxiety, that often results in increased tension in the body. So we look at all of those components together when we're working with someone with pelvic girdle pain. And so making sure that they're able to relax their body, bringing them through stretches and mobility exercises, but then also finding out what their thoughts on birth are and if they might benefit talking to another healthcare professional about that. And so now if we think about the bio part, so the fact that they are experiencing pain and discomfort, some of the things that we'll do to help them was that we'll talk about bed mobility. So moving in bed in a way that supports their pelvis and supports equilibrium between both sides of the pelvis. And so that includes making sure that they're contracting their glutes as they turn side to side. And there's another video on our channel about that. We'll also talk about creating balance between both sides of the pelvis. So it's not that the pelvis is unstable, but that sometimes there's increased tension on one side and that causes pain as it pulls to the other side. And so some of the things that we'll do is encourage different seated positions. So encourage people to sit with their legs parallel. So not necessarily their legs glued together, but their legs parallel. So sitting both legs down, crisscross style, both legs bent, and then avoiding positions like crossing one leg over the other or curling up on one side with both legs on one side or the other. And that just helps create a little bit more equilibrium in the pelvis. And then there are other things that we can do, like encouraging butterfly sitting and other types of stretches to support the pelvis in this way. A big thing to know about pelvic girdle pain is that it can be resolved, and it's not something that will necessarily worsen over the course of your pregnancy. And so talking to your healthcare provider, talking to a pelvic floor physiotherapist can really help resolve this pain and ensure that you have as comfortable a pregnancy as possible.